Hi there, I'm Dr. Hodge. First thing I want to show you is the setup screens and how easy they are to log into. There's three things you should know about me. First, I'm a pediatrician, and I've spent the last 19 years taking care of families and patients. And the second thing you should know about me is that I have a daughter with type 1 diabetes, so I learned a lot in that experience of caring for her. And insulin is a very difficult drug to dose, and you can get too much, you can get too little. It's life-saving for her, but it's very expensive. And as I moved back to Kentucky several years ago, I noticed lots of problems with overweight and lifestyle disease. And I thought to myself, why would anyone in their right mind not do everything they could to not progress to having to take insulin with type 2 diabetes? And then the third thing about me you should know is that I was very affected coming back here and seeing friends dying from sudden cardiac death, smoking-related illness, diabetes-related illness, and noticed that our community hospitals were full of lifestyle disease. In fact, 80% of our healthcare costs come from lifestyle disease. And so I said to myself, with the technology we have now and the technology I'm about to show you, that's just really senseless. So first thing I want to show you is, here we are. Beep. The first thing about our platform is that it's very easy to use. It's very easy to access. You don't need a desktop computer. You don't need wireless internet access at your home. There are 89 million type 2 diabetics. We think that's ADA's estimation. And there are 63 million iPhone users in the U.S. So the first thing I want you to see is the setup screens. And I have mine set to my height, 5'4", and I've made myself a smoker just for the messaging, and I'm not diagnosed with diabetes, and I'm a female. And then let's come back to the dashboard, and you can see the messaging here. I found myself saying the same things to patients over and over and over. Drink more water, eat more fruits and vegetables, and get active. The same three things all day long, over and over. So I felt like creation of this platform could be a way to automate that. And it's actually just a game. It's a simple game of tapping your screen, getting your screens to green. And the pedometer is the neat part. I'm just going to take a walk around the room here. And we have it set just on demo mode, so it only takes 30 steps to get to your goal. And when you get to the goal steps, yay, your goal's achieved. You've made your steps for the day. Yeah. Except that the daily steps for the user version are actually 10,000, and that's recommended by ADA, American Heart. And the exciting thing about that is that can help a type 2 diabetic or a pre-diabetic with a marginal blood sugar, say 130, 135, exercise for 30 minutes vigorously if their blood sugar is high, and get to a normal blood sugar. So it's a prescription for exercise, and I prescribe this to patients in my practice, and I'm hoping that it can save me from having to say the same things to patients. Now, let's put in a little weight goal here. Let's say 140. Let's say 140. Let's put in 159, just to get a little marginal weight for what my height is. And you can see the weight comes in red, and to notify the user that's too much. And also notice in the lower corner here, the BMI, 27, that's yellow. So that's in the early zone of overweight. And the next part I want to show you is the blood pressure messaging. And let's just put in a blood pressure that's a little, I have lots of patients like this, you probably do too, 135 over 85, and let's just save that. And uh-oh, you get a little message that pops up here that says your blood pressure's in the caution range, increase your daily activity, pay attention to your log, try to increase your steps, check again, if not, go see your doctor. Okay. And then the blood sugar piece here, lots of people walking around with blood sugars that are marginal. Let's put in 135 and save that. And eeks, that number is a little high. If you have not been diagnosed with type 2 diabetes, see your doctor immediately. If you have, sign up for reminders, use the pedometer, recheck your blood sugar after 30 minutes of vigorous exercise. Okay, so that's what you need to do when your blood sugar is a little marginal. And the color coding all gives the user a sense of where they are. So what we've done is taken, if you look at this dashboard as a whole, we've taken all of your health behaviors in the middle screen and all of your health data, personal health data, and color coded it, and we're trying to create a game of getting your screens to green. Now, some users with prediabetes may take them a month. Some users with prediabetes may take them a year, but the point is, you're trying. We have messaging. Show you the messaging, and I'm going to sign up for a sleep reminder. Let's turn that on. We all need to go to bed at night, so we get enough sleep. And there's some smoking cessation reminders, a photo upload feature, which is exciting. And then we have some nutrition coaching tips. I'm going to sign up for a couple of those. And then you might have an exercise reminder, certain time of day that you want to go and do a walk. I like the morning. Let's do 8:30. And stress reduction, American Heart Guidelines, American Diabetes Guidelines recommend stress reduction, biofeedback meditation, and to reduce your risk of stroke, lower your blood pressure, lower your risk of heart disease. And some water reminders. This is easy to forget. Drinking your water. Oftentimes we eat when we're really just hungry. And then let's add in a couple fruits and vegetable reminders. So what you see is basically a game of health. And if you get your screens to green, then you won. You've won your health back. And this is easy. Anyone can use it. You can download it in the App Store and improve your health. Thank you so much.